We're here this morning with Dr. Bob Smith, who has an extensive background in pediatrics, and he's here to share some questions or some answers to some questions about this age group. But first, I'd like to just turn it over to you, Bob, and see if there's anything you'd like to say by way of introduction.
Yes, well, Mary Kay, this is certainly a pleasure, and thank you for your wonderful questions. Been looking forward to this. I am a general pediatrician. I trained at Emory, was in private practice in the Marietta and Woodstock areas for about 28 years. For the last 8, I've been a pediatrician in emergency departments, and I am recently retired. And I can truly say that I've had a very enjoyable, challenging, and rewarding career. And
That's great.
I'm grateful for this opportunity.
Well, good. Well, welcome to retirement.
Thank you.
Absolutely. So we'll just hop right in. What are the top 3 concerns you've encountered from parents of infants?
Yes. Well, an infant, a newborn, it's a wonderful time of happiness and celebration. It can be a time of great anxiety, too. There are varying degrees of personal support for the family. There's the disruption of routines and developing new routines. There is a financial impact. And in the midst of this, there is also some sleep deprivation. Fortunately, for most of us, it's a very happy, enjoyable time, and it goes by all too quickly. It's a time of great responsibility. So the concerns around that are, am I doing it right? And I can assure you, those who are praying, doing the best they can, talking with other parents, getting advice from the best sources possible. If you do your best, you'll do well. There are things that are under our control, and as we learn as being parents, and I have raised 2, and my wife have raised 2 children who are now young adults. It is challenging, rewarding at each step along the way. And you always wonder if you're getting it right. And I will tell you that none of us are perfect parents. There are choices that we would have made differently had we to do it over again. But we prayed, got advice from the best people that we knew, and we made our decisions. And we talk about some of our decisions now. But the way we went about it, I can't say that we have regrets. There are many questions that come up around growth and development and nutrition. We'll talk about that a little bit later, perhaps. So those are concerns. Pediatricians, nurse practitioners are well equipped to handle those questions and to provide guidance. More recently, we've had concerns about vaccines. No medication is without side effects, and that's certainly true of vaccines. The common reactions are swelling at the site of the injection, some rashes, low-grade fever. There are more serious reactions. So I encourage parents to do their research, do research from reliable sources, medical schools, the American Academy of Pediatrics. So much what comes up on internet chat is not as reliable as we would like for it to be. I think some of the difficulty in assessing the risk versus the benefits is that we are now at a distance from when these diseases were prevalent. I saw a case of meningitis in the emergency department, bacterial meningitis, about 3 months before my retirement. That was the first case that I had seen in about 28 years.
Wow.
So that is how effective these vaccines have been. It was not an uncommon event when I was in training between 85 and 1988. But that's a rare disease now. Measles in the Civil War, 67,000 soldiers contracted it. It left 4,000 dead. We are at a distance from polio as well. The days when pools were closed, mothers were terrified. They did not let their children out of the house for fear that they would wake up with having lost the ability to use their arms and use their legs or even breathe. So these are distant memories. Fortunately, we don't have the smallpox vaccine. That disease has been practically eliminated. Back during the interesting historical fact, back during the Revolutionary War, 3 out of 10 Revolutionary War soldiers contracted smallpox.
Really?
As a result, General Washington mandated vaccines for his troops. It was not a very sterile or nice technique, but it involved pulling some serum from an open lesion and placing it on a soldier's open skin. It did result in disease, but it was a less severe disease. So we have been with vaccination and vaccine mandates for some time. But please do your research and prepare yourself with concerns and questions, and your doctor or nurse practitioner should be willing to engage in that conversation and relieve some anxieties about some of these side effects.
That's fascinating. I had no idea about that with George Washington. Yeah, and that's interesting too that mandates have been around that long. So I'm curious, when you perform well visits, what are you looking for and what might give you concern?
Yes. Well, to start out, pediatrics is more than just taking care of the infant. We work with families. So a child comes with a family and with caregivers and with extended family. And the first assessment is just the gestalt of the room. How is our parents relaxed? Do they seem fatigued? Are they anxious? We like to get to know the family. And much can be done in the way of providing support. There are support resources within the communities, but I think that's an important part of the relationship, them getting to know us and us getting to know them. Within the context of the well checkup, there are various elements that the American Academy of Pediatrics mandates for these visits, or recommends for these visits, rather. So there are another number of screenings. There are labs. We test for lead. We check hemoglobins. There are some questionnaires that deal with development. Does your child perform various tasks? There are screens for lead. There are screens for cholesterol. There are screens for maternal and for child depression. So one challenge that many of us struggle with is the balance of including these components of the vaccines versus addressing the question. So many of us like to begin with an open-ended question to you today. How are you doing? And then just listen for a few minutes and address those priorities. And then we or a care team person will administer the very but we should be putting our parents and their concerns first. Addressing their questions. So we also want to know what you like to celebrate. What's going well for you? As time passes, we get to know your child over the years. There's a very rich relationship there. And if you are prepared with questions, things that you would like to celebrate, things that are of concern, the visit will be more complete. We get to know you, you get to know us, and it's a more satisfying experience, I think, for all of us.
Oh, that's great. I know my children are now 19 and 16, but our first pediatrician and their babies still feels like part of the family. And if we were to run into them, even though they're in a different state now, I would still feel like we know each other really well. And I'm grateful for that relationship and appreciated the opportunity to bring questions. That was always, I never felt like I had a dumb question. And that was a gift. That was a real gift.
There's no dumb question.
Yeah. So if we have a special needs child, what do you recommend as the best way to support that child, and how can parents advocate for them?
Yes. Fortunately, most children are healthy, but there are now a variety of special needs. And all of these children are so unique, although many have things in common. And each family around this child is so unique. So the variety and the severity, there's a very broad range from pulmonary, heart, neurological problems, developmental issues, syndromes, genetic disorders. Again, fortunately, most children are healthy. We even have some special needs children who might not have survived in earlier decades, but medicine has now evolved to allow many to live very good and active lives. In practice, in the emergency department, I saw some parents neglect themselves in an attempt to better support the child. So I think it's important for these families to have support, for the caregivers to have support, and that they take care of themselves with time for rest, for meditation, for prayer, for exercise. So taking care of yourself. Fortunately, now one of the benefits of the internet is that there are so many support groups out there, and many good support groups, chat groups. So even for children with unique cardiac problems. Back in my earlier years in practice, I had a patient with an underdeveloped left heart, which supplies the circulation to the arms and legs and nervous system, chest. Had an underdeveloped left heart, and there is a British organization. I received a T-shirt, and it's called Left Heart Matters. So,
wow.
I believe it's still in existence. So there are a variety of support groups out there, discussion groups where parents can exchange information and advice and receive input. In the larger children's hospital systems, many have multi-specialty clinics for problems such as spina bifida. This is when there is an opening in the vertebral column over the spinal cord. Those may include gastroenterologists, urologists, neurologists, orthopedics, physical occupational therapists, and very importantly, social workers who are there to support the family. I think it's also important that these special needs children, to the degree possible, be exposed to other children with not only those who are disabled, but those who are higher functioning. It's a great service to all of us. Children can teach each other, and many are very loving towards each other. I saw this particularly with some families in our church who had special needs children, and the way that they were endorsed and encouraged by other families, parents, and children alike. So being a part of that faith community is a critical element.
I know. I think that when I think about Jesus coming as an infant, that's a really powerful lesson to me. And I try to remember that children still lead us, and oftentimes are the best examples for us grown-ups who think we have it figured out. But I learn more from kiddos than I do from grown-ups sometimes.
We all have a lot to learn, and they are good teachers. Yes.
Indeed, indeed. So kind of transitioning back to a more typically developing child, at what age does a child not walking concern you, or not being potty trained, or not talking? Like, at what ages should those milestones start popping up?
Yes, good questions. There is a screening tool that many pediatricians use in their clinics and nurse practitioners. I'm a big fan of nurse practitioners. So we have the developmental screening test is called the Denver Developmental Screening Test. And on that chart, you can see at what point 95% of children will have gained a certain skill. So, for example, walking. Some children may walk as early as 11 months. 95%, though, will be walking well by 14 months. So at or around 14 months, a little later, that doesn't mean that's necessarily abnormal, but that's when we begin to have concern, because that's 2 standard deviations from the average.
Gotcha.
That would be a concern. Talking, children will say mama and daddy 95% by 13 months, although some will as early as 7.5 months. 95% of children will say 2 words at 15 months, although some may as early as 10 months. you're getting an understanding of the range.
Right. That's great.
95% of children will say 3 words at 17 months, although some will as early as 11 months. And 95% will say 6 words at 18 months. Some will say 6 words as early as 14 months. Now, for potty training, which is often a struggle, this becomes a topic typically at around the 18 to 24-month checkups. Children are not neurologically capable of being potty trained, many until they're at least 24 months old. The average age is about 27 months. So these nerve tracts, these fibers are not mature enough to allow that until about 2 years. But to do this, each child is different. They have to have the awareness, which is the nervous system. They have, and the fiber tracts, they have to be able to learn. And then they have to be not fearful, but willing to learn. So the average age is going to be about 27 months. Some may not be fully daytime continent until 3 years or a little bit older. Most are nighttime continent by 4 years, although there are occasional wet bed wetters that lack nighttime control, even on into the early school years and sometimes even into the teenage years.
Is that just a developmental change, like their bodies growing faster, or I'm just curious?
Yes, the children who are late bedtime wetters, it seems to be a sleep neurological issue. And so there are ways to train that. Urologists sometimes recommend alarm systems. We as pediatricians, when I was doing this, would recommend that parents wake the child up at varying points during the night to determine the interval between sleep onset and when the bedwetting episode is likely to occur. And then we would recommend that they wake them up just before that time and take them to the toilet. And over time, that seemed to be a recommendation that helped many parents reduce the frequency of this. But certainly any child who is a very late, older bedtime, lacks bedtime continence, we look for other things as well. So it could be a neurological problem, so forth. But most typically, it's a sleep issue, or at least very often.
That's interesting.
Mm-hmm. Yeah.
So what do you wish that you could tell every parent that's expecting a child?
Yes, that's a very good question. And so many thoughts came to mind. One is, I would just say, be a part of a faith community. Pray and do your best, and that will be more than enough. None of us are perfect parents. My wife is a registered nurse. We met at Eggleston, and there are things that we would do different. We would make different choices now. We did the best we knew at the time, as I said, based on our research and the best advice that we had. And how we went about it, I don't have regrets. Looking in hindsight is always 2020. But we are grateful for the support that we had, and we feel like we did the best that we could, and we enjoyed a rich relationship with our children. I would say take time. We are often so rushed these days with activities and travel teams and homework, and but take time, enjoy the relationship, encourage their curiosity about different people, different cultures, curiosity and interest in the arts, in being outdoors together, in sports and activities. Each child will find their affinity, but it's through exposure to other people and to different elements of our environment. Engage and encourage them, and if something doesn't work, the next thing will, perhaps. And then I think one of the habits that we tried to develop and that I see other families trying to develop is having their meals together. It's, I think, having all sets of legs under the table frequently over the course of the week and sharing in discussion and enjoyment of food, learning how to prepare the food, learning how to shop for it, how to select, choose menus. That for families can be a very engaging and rich task. And nutrition, good nutrition can be a real challenge for parents these days. But I would say take time for that.
Oh, that's really helpful. That was one practice that we partook in as well. And what I realize now, as my children are older, is the beautiful benefit of that is that they have a few skills to take with them when they're out of the house on how to prepare food and put menus together and that sort of a thing. So I appreciate you mentioning that.
Yes.
What do you think the best gift we can give our children is as parents?
That's a wonderful question, and there are probably so many answers. Personally speaking, the biggest gift that I received was growing up in a small town and being a part of a faith community there. And I grew up in a small primitive Baptist church in Statesboro, and there were so many people, so many families who really, truly cared about each one of us. My father passed away recently, and I was down there, and many of these folks I had not seen in decades. And we just picked right back up where we left off. And I saw people who taught me in vacation Bible school. Some of my Sunday school teachers are no longer living. I'm 66 now. But growing up in that environment where people truly cared for us and worshiped with us, and we saw them during the week, having those relationships then and now is the greatest gift that I've received.
I think that's so helpful. I think
my family.
Yeah, I get that. I know. And that's where I wonder, especially after coming out of COVID, part of what gave birth to this idea of an online parenting library was that we were all conditioned to silo and to be isolated. And I received some of those same gifts, like knowing that I have biological parents, but I also have a whole bunch of community-wide parents that were pouring into me, looking out for me, keeping me on the straight and narrow. And to have that level of support and relationship is such a gift. So I appreciate you highlighting that, because some of my Sunday school teachers today, I can still quote some of the lessons they gave me. But more importantly, I still know the love that they shared with me.
Thank you. Well said. I feel the same. Thank you.
How do we develop a positive relationship between our children and their medical providers? I know some people say their kiddos are scared of shots or they're scared of going to the doctor, but what can we do as parents to help facilitate a positive relationship?
Yes, very good question. This is truly a two-way street. Parents want to know, and I think must know, that their provider really cares about them. So I'll talk with other parents, interview different pediatricians, have different styles, but I think all of us want to engage our patients and our families around areas of common interests and activities. So have that interview and see what feels right. Talk to other parents. When families would move to new communities, I would encourage mothers to talk to members of their faith community and to mothers of schoolmates. And mothers and fathers know what different styles are like and can usually make very good recommendations. As far as preparing for the visits, I saw a lot of children who came in with their dolls and with their doctor kits, and they'd been doctoring on their dolls the night before, and we would play with some of their instruments, and then I would take out my stethoscope and hammer, and we'd do the same. So I think that helped kind of ease them into it. Many of my families I knew from outside the practice. I saw families because I was Robert and Carolyn's dad, and because I was Lisa's husband. And we'd see each other at church. We'd see each other at the swimming pool, at the soccer field. So the pediatricians who were out and involved in the community, I think, got to see the patients in different contexts, and we had a level of comfort with each other. Of course, it's possible to do that without those elements, but it's certainly less challenging. But I think just taking the time and letting us know a little bit about yourselves. We're interested. We want to know. It helps us remember patients and names and the contexts of medical conditions. That's so important. So interview, it's a two-way street, and find your style.
That really is, that relationship piece is so critical. Thanks for being out in the community. That was always fun for my kids to see their doctor outside of the practice, to know that they had a real life too. So that was really helpful. I'm curious now, like talking really nuts and bolts, but what's the deal with brain development? How do I know that my baby is developing cognitively appropriately? And a follow-up that's, years in the making. When are our children actually adults?
Yes, thank you for that question. As we said earlier, there's a wide range of normal development. And there are some children who are outliers. I think we get our best advice from those who are seeing a wide variety of children over a course of many years. Teachers, pediatricians, sometimes we even call on developmental specialists to assist us with this. But as a pediatrician, I always like to talk with the preschool teachers and with the Sunday school teachers or with the grade school teachers to get an idea of what they viewed as unique about this child. And then if further assessment was needed, we could make other referrals. We also know now that nutrition and that activities in which children are engaged can develop the brain in different ways, to such an extreme that children who are born with underperforming parts of the brain, stronger areas can be recruited to compensate for those areas that are weak. And so the kinds of activities that we involve ourselves in can, as much as our church community shape and support us in our faith, the stimulus that our brains receive can strengthen or even weaken other areas of the brain. I think smartphones limit social interaction. This may be a prime example. The children who are inclined to disorders such as autism, where their social communication interaction skills are impaired, if they're left for long periods with these smartphones where they're engaging with a game and it limits outside contact, they really need exposure to other people. So that understanding that aspect of it, we can encourage our children to engage more with the other children around them. As we said earlier, sports and arts and reading and music and the other elements of interests can shape and form us along the way. So nutrition is important. Formulas have been developed and refined so that the neurologic outcomes are optimized. But it's been a true progress has been made since I was in training. As far as when we are really adults, I would say even now in retirement, it is so humbling. We truly have so much to learn. And at any age, we can exercise poor judgment. We can engage in destructive behaviors and habits. And I think that the mark of maturity is that when we question and when we look outside of ourselves and with humility to God, to family, to community for assistance, and pray, recognizing our vulnerability, that we are more spiritually, physically, cognitively mature.
That makes a lot of sense. This has been fantastic. Is there anything else you would want to share that we may not have touched on, or that you wish that I had asked?
No, I am just so grateful for the experience. I learn something each and every time, and I have truly enjoyed doing my bit of homework and supporting this effort, and getting to know you, Mary Kate, and to knowing our congregation better. And thank you for this. Thank you for this opportunity. I wish you well. It is an outstanding effort. Thank you.
Well, thank you for being part of it, and I look forward to sharing the finished product with you. Have a great afternoon. I'm going to stop our recording.
Okay.